These are 6 evidence-based home remedies that can reduce leg and foot nerve pain, and one common supplement that actually makes neuropathy worse if you take too much of it. Every approach covered in this video comes from clinical research, and by the end you'll know which ones have real science behind them and which safety warnings every person over 60 needs to hear. 20 to 30 million Americans live with peripheral neuropathy right now, according to the National Institute of Neurological Disorders and Stroke. That number alone is staggering, but here's the part most people miss. Even without diabetes, your chances of having this condition sit somewhere between 27 and 39% once you pass 70. Among adults aged 78 to 100, a study from the ERIC cohort put the prevalence at 62%. Burning feet at night, tingling in the toes, numbness creeping up the ankles, stabbing pain that comes and goes. If any of that sounds familiar, you are far from alone. And while no home remedy replaces working with your doctor, several of these approaches hold up under serious clinical scrutiny. Let's go through each one, starting with what's actually happening inside your body. Your peripheral nervous system carries signals between the brain, spinal cord, and the rest of your body, and the NIH has identified more than 100 types of damage that can affect it. The form that hits seniors most often goes by the name distal symmetric polyneuropathy. That's a clinical label for a straightforward pattern where the longest nerve fibers break down first. Symptoms almost always begin in the toes, creep into the feet, climb to the ankles, and work their way up the lower legs, sometimes eventually reaching the hands. Doctors call this the stocking and glove distribution because the affected areas look exactly like where socks and gloves would sit. What people feel varies quite a bit. Some describe burning pain, others report electric shocks or pins and needles, and a fair number experience total numbness. Night tends to make everything worse. Over time, muscle weakness and loss of balance can set in, which brings us to something you need to pay close attention to. A 2024 study in the Journal of the Peripheral Nervous System found peripheral neuropathy to be an independent risk factor for falls, with an odds ratio above 17. 88% of all falls in that study happened in the neuropathy group. Non-fatal older adult falls already cost $80 billion a year in the United States, according to the National Council on Aging, which means treating neuropathy goes well beyond pain relief. Staying upright and independent depends on it. Diabetes accounts for roughly 30 to 32% of all peripheral neuropathy cases, making it the single leading cause. About half of all diabetic patients develop neuropathy during their lifetime, and 10 to 20% already have it the day they receive their diabetes diagnosis. Plenty of other triggers exist as well. Chemotherapy causes neuropathy in 30 to 68% of patients on neurotoxic drugs, and chronic alcohol use, vitamin B12 deficiency, autoimmune conditions, and hereditary disorders like Charcot-Marie-Tooth disease all contribute. What surprises many people is that 25 to 46% of cases never receive a clear explanation at all. Doctors label these idiopathic, and that percentage climbs higher the older you get. With that foundation in place, let's talk about what you can actually do at home. Remedy number 1, alpha-lipoic acid. Out of every supplement ever studied for peripheral neuropathy, alpha-lipoic acid, also called ALA, carries the strongest body of clinical trial data, especially for diabetic neuropathy. ALA works as a potent antioxidant that goes after oxidative stress, one of the root mechanisms driving nerve damage. The landmark studies tell a clear story. Back in 1995, the ALADIN trial enrolled 328 patients and tested intravenous ALA at 600 milligrams. Neuropathic symptoms dropped by 63.5% in the treatment group, compared to 38% for placebo, and the response rate came in at 82.5% versus 57%. What matters most for home use, though, is the Sydney 2 trial, published in Diabetes Care in 2006. That trial tested oral ALA, meaning pills you swallow rather than injections, at 600 milligrams per day over 5 weeks. Statistically significant improvements showed up across every measured symptom: pain, burning, paresthesia, and numbness. Researchers also tested 1,200 and 1,800 milligram doses, and neither proved more effective, they just caused more nausea. The longest study ran for 4 full years. Called the Nathan 1 trial, it tracked 460 patients across 36 centers. all taking oral ALA at 600 milligrams daily. Nerve impairment scores improved, and the treatment proved safe and well-tolerated across that entire duration. Now here's where transparency matters. A 2024 Cochrane review, which represents the gold standard for evidence analysis, examined 3 randomized controlled trials and concluded that ALA probably has little or no effect on neuropathy symptoms at 6 months. Mayo Clinic has described the results as mixed, saying larger studies are still needed. So where does that leave you in practical terms? 600 milligrams by mouth each day remains the most studied dose. Monthly cost runs about $14. Germany approves ALA as a prescription medication for diabetic neuropathy, while the United States sells it as a dietary supplement. One safety point you cannot skip: ALA can lower blood sugar. Anyone taking insulin or oral diabetes medications needs their doctor's approval before starting it, because it can also affect thyroid hormone levels. That conversation with your physician is non-negotiable. Remedy number 2: exercise, especially balance training. If you force me to pick a single home remedy backed by the widest evidence, exercise would win. A 2022 systematic review and meta-analysis covering 41 randomized controlled trials confirmed that exercise stands as the best documented non-pharmacological approach for neuropathy across multiple types. And the specific finding that stands out? Balance training ranked as the single most effective exercise type for both motor and sensory symptoms. Not jogging, not heavy lifting, balance training. For diabetic neuropathy in particular, aerobic exercise helps by pushing more blood into the extremities and pulling blood sugar levels down. Programs that blend balance work with aerobic activity and light resistance training delivered the strongest overall results in that meta-analysis. Cleveland Clinic neurologist Dr. Benjamin Clater put it directly: if the neuropathy stems from diabetes, exercise and weight loss may actually lead to stabilization or improvement in the neuropathy. Tai Chi studies showed something particularly striking, with participants improving from moderate to high fall risk all the way down to low fall risk. Yoga produced positive results as well. Both qualify as low-impact options accessible to most seniors with proper guidance. Aim for 2 to 3 sessions each week over at least 8 weeks. And try to get initial supervision from a physical therapist or qualified instructor. Given what we covered about the fall statistics, anything that sharpens your balance may rank among the most protective choices available to you. Let's begin with remedy number 3, capsaicin cream. This one traces back to an unlikely source: chili peppers. Capsaicin, the compound responsible for that familiar heat, activates specific pain receptors called TRPV1 receptors when applied to the skin. Repeated use triggers what scientists call defunctionalization, a process where nerve endings temporarily lose their ability to send pain signals to the brain. 2 forms exist that you should know about. The prescription version carries an 8% concentration, sold under the brand name Catenza, and it received FDA approval for painful diabetic peripheral neuropathy of the feet in 2020. A Cochrane review found it generated about 10% more pain responders than placebo, with effects lasting roughly 12 weeks per application. A healthcare professional handles the application, so this one doesn't happen at home. What you can use at home are over-the-counter creams at concentrations between 0.025 and 0.075%, available at most pharmacies under names like Zostrix and Capsaicin P. Evidence for these lower concentrations remains more limited. A 2012 Cochrane update described the data as insufficient for firm conclusions, though pooled results from 389 participants showed the 0.075% cream reaching a number needed to treat of about 6.6 for any pain relief over 6 to 8 weeks. Expect a burning sensation when you first start applying it, and know that this fades after several days of continued use. Reduced sensation in the feet, which many neuropathy patients already have, means you'll need to watch closely for skin reactions you might not feel. Wash your hands thoroughly every time you apply it. No known systemic drug interactions exist, which gives capsaicin a real advantage for anyone juggling multiple medications. Next, we have remedy number 4, TENS therapy. TENS stands for transcutaneous electrical nerve stimulation. A small portable device delivers mild electrical impulses through electrode pads placed on the skin and the American Academy of Neurology assigned it a Level B recommendation, meaning probably effective, for diabetic neuropathy pain in their 2010 evidence-based review. The concept behind electrical pain relief stretches back thousands of years. Ancient Egyptians and Romans placed electric torpedo fish, which deliver between 8 and 220 volts, directly onto painful body parts. That qualifies as the earliest known version of what we now call TENS. The modern electronic device came about by accident in the 1970s when neurosurgeon C. Norman Shealy built a unit purely to test whether patients could detect electrical impulses before a separate procedure. Patients reported such relief that the device became a therapy on its own. Home TENS units today carry FDA clearance as Class II devices, cost between $25 and $150, and qualify for FSA and HSA accounts. A meta-analysis of 3 randomized controlled trials documented significant pain reduction at both 4 and 6 weeks of regular use. One firm contraindication: cardiac pacemakers or any implanted electrical device rule out TENS completely. Because neuropathy dulls your ability to feel, setting the intensity too high poses a real danger. Start at the lowest setting, increase gradually, and check your skin for any signs of electrical burns after every session. Remedy number 5, vitamin B12 and the B6 warning. 2 parts to this section, and the second one may contain the most important safety information in this entire video. Vitamin B12 first. Deficiency in this nutrient runs extremely high among seniors, affecting between 10 and 25% of people over 80, largely because gut absorption declines with age. Metformin, the widely prescribed diabetes medication, also drains B12 from the body. B12 deficiency by itself causes peripheral neuropathy. A 2021 randomized, double-blind, placebo-controlled trial published in the journal Nutrients followed 90 patients with diabetic neuropathy who were taking metformin. After 12 months of methylcobalamin supplementation, that's the active form of B12, researchers documented significant improvements in nerve conduction, vibration perception, and pain scores. The Foundation for Peripheral Neuropathy names B12 deficiency as a treatable cause of neuropathy, and many medical professionals suggest that all seniors over 60 get their levels checked regularly. When supplementing, look for methylcobalamin rather than the cheaper cyanocobalamin form. Now the B6 warning. Pay close attention here because this is counterintuitive and genuinely dangerous. Vitamin B6, also called pyridoxine, sits at the center of a medical paradox. Deficiency can contribute to neuropathy, but taking too much B6 as a supplement is itself a well-documented cause of peripheral neuropathy. Health authorities set the tolerable upper limit at 100 milligrams per day. Yet case reports describe neuropathy developing at doses as low as 24 to 50 milligrams per day in people who happen to be susceptible. The mechanism behind it borders on bizarre. Excess pyridoxine blocks the very enzyme that converts it into its active form, which creates what amounts to a functional deficiency despite blood tests showing plenty of B6 circulating in the body. Australia's Therapeutic Goods Administration tested blood samples and found that 4.5% returned B6 levels. That very likely pointed to nerve damage. That finding prompted reduced maximum permitted supplement doses and mandatory warning labels on anything above 10 milligrams per day. Here's the hidden trap for seniors. B6 shows up in more products than you'd expect. Your multivitamin contains it, your B-complex supplement adds more, and even some magnesium-zinc combinations include a dose. Those amounts stack up quietly. B6 toxicity symptoms usually resolve within 6 months of stopping the offending supplement, but severe cases can produce permanent damage. Check every supplement label in your medicine cabinet right now and add up the total B6 content. Anything above 50 milligrams from all combined sources warrants an immediate conversation with your doctor. Remedy number 6. Mindfulness and stress reduction. Hearing mindfulness in a video about nerve pain might sound out of place, but clinical trial evidence backs this up. A 2020 randomized clinical trial by Yildirim and Essen enrolled 77 patients with an average age of around 63, and found that both progressive muscle relaxation and mindfulness meditation drove neuropathic pain severity down over 12 weeks. Separate research by Nathan and colleagues, published in Clinical Diabetes in 2017, showed that mindfulness-based stress reduction, known as MBSR, improved function, quality of life, and pain intensity for patients with painful diabetic neuropathy when compared to standard care alone. The science here isn't mysterious. Chronic pain feeds itself through a well-documented loop connecting stress, poor sleep, and heightened nerve sensitivity. Structured relaxation practices break that cycle, which measurably dials down the pain signals traveling to the brain. No cost, low risk, and fully doable at home with free apps or guided audio programs. Mindfulness won't replace your other treatments, but it fits naturally into a layered approach. What's coming next in treatment? New treatments are arriving at a pace we haven't seen before. Neuralace Medical's Axon therapy picked up FDA clearance as a non-invasive magnetic peripheral nerve stimulation system built specifically for painful diabetic neuropathy. High-frequency spinal cord stimulation produced significant pain reduction in the INSPIRE clinical trial. And a 2024 study in Scientific Reports tested a near-infrared photobiomodulation device that achieved 100% improvement in nerve conduction across treated nerves. Drug development is moving fast as well. ART-26.12, a non-opioid compound targeting the endocannabinoid system, entered Phase 1 clinical trials in January 2025. ST-503 received FDA Fast Track designation specifically for small fiber neuropathy. Researchers at Ohio State University broke new ground with a gene therapy approach that triggered actual nerve regeneration in diabetic mice. The 2021 American Academy of Neurology Guideline Update, the most current evidence-based treatment guideline available, reviewed more than 133 randomized controlled trials and explicitly recommended against opioids for diabetic neuropathic pain. That same guideline recognized complementary approaches including exercise, mindfulness, cognitive behavioral therapy, Tai Chi, and topical capsaicin. Dr. Brian C. Callahan from the University of Michigan, who led that guideline, stated, "Living with pain can greatly affect a person's quality of life." Painful diabetic neuropathy is very common, so people with diabetes who have nerve pain should discuss it with their doctor because treatment may help. When home remedies are not enough. Before wrapping up, you need to know the red flags that call for immediate medical attention rather than home management. Those include progressive weakness, especially when muscle weakness outweighs sensory symptoms. Sudden onset of any symptoms. Autonomic dysfunction, which shows up as dizziness when standing, heart rate irregularities, or urinary problems. Symptoms limited to one side of the body only. Numbness that's climbing upward rapidly. Any foot wound that refuses to heal. All of these can point to conditions like Guillain-Barré syndrome or vascular emergencies requiring urgent neurological evaluation. Drug interactions deserve your full attention too. Blood thinners like warfarin and aspirin interact with more supplements than most people realize. Alpha-lipoic acid, fish oil, garlic supplements, and curcumin all raise bleeding risk. St. John's wort can dangerously weaken the effectiveness of blood thinners, antidepressants, and blood pressure medications. Anyone undergoing chemotherapy or radiation should know that high-dose antioxidant supplements may shield cancer cells from the very treatment meant to destroy them. Your oncology team needs a complete list of every supplement you take. Bringing it all together, let's recap what the clinical evidence actually supports. Alpha-lipoic acid at 600 milligrams daily carries the strongest supplement data, though the debate around it continues. Balance-focused exercise may be the most impactful lifestyle change available to you because it addresses pain, fall risk, and metabolic health all at once. Capsaicin cream offers a drug-free topical option with no systemic interactions. B12 testing and supplementation belong on every senior's checklist after age 60, doubly so for anyone on metformin. TENS units deliver affordable, low-risk pain relief you can manage at home. Mindfulness practice measurably reduces pain when layered with other strategies. On the safety side, vitamin B6 from all sources combined should never exceed 50 milligrams per day. Warm foot baths demand a thermometer without exception. No supplement should enter your routine until your doctor knows about it, because interactions with existing medications can turn dangerous quickly. According to a study in the Journal of Neurological Sciences, 43% of neuropathy patients have turned to complementary therapies, but only 27% reported improvement. That gap tells us something honest. No single remedy works for every person, which makes a layered approach, one that stacks the strategies working for your specific situation, more realistic than chasing a single fix. Harvard's Dr. Robert Schmerling captured the broader challenge when he wrote, "When the best treatments work well for only a quarter or less of patients, and nearly half quit treatment in the first 12 weeks, it's clear that better, safer, and less expensive treatments are needed." Based on what we covered today, those better treatments are genuinely on the way. Until they arrive, the evidence-based home remedies in this video give you real, practical tools you can start using right now. Just make sure your doctor stays part of the conversation. If this helped you, share it with someone dealing with nerve pain. Subscribe to the channel for more evidence-based health content, and I'll see you in the next one.